Today, we're going to talk about nephritic syndrome. As stated in the name, it is a syndrome or a collection of symptoms which typically occur together and not a disease in itself. One of the functions of the kidneys is to clear the body from toxic and unwanted waste, and the way it does that is by filtering these substances out of the blood. So, in the glomeruli of the kidneys, we have the filtration barrier. The filtration barrier is made up of three components: the fenestrated capillary endothelium, the basement membrane, and the podocytes, referred to as the epithelium. The fenestrated capillary endothelium has openings, or fenestrations, that allows only small molecules to pass through. This will repel red blood cells, white blood cells, and platelets, preventing them from being excreted in urine. Next, we have the basement membrane, which contains negatively charged molecules, namely type 4 collagen wrapped in heparin sulfate, and as a result, the basement membrane will repel negatively charged molecules such as albumin, and it also acts as a size barrier, allowing only small molecules through. Finally, we have the podocytes, which are the epithelial cells with long foot-like processes that wrap around the capillaries. The slits between the foot processes filters blood, acting as another size barrier. So, on a fundamental level, glomerular diseases lead to a breakdown of the filtration barrier, which will lead to things in the urine that shouldn't really be there, specifically red blood cells and proteins. So, on one end, we have nephritic syndrome, where the patient will present with hematuria, or red blood cells in urine, and mild proteinuria, or protein in urine. And on the other end, we have nephrotic syndrome, where patients present with massive proteinuria and hyperlipidemia. We will only talk about nephritic syndrome in this video, and to learn about nephrotic syndrome, please watch our previous video. So let's talk about nephritic syndrome. This is an inflammatory process that damages the entire glomeruli. The filtration barrier to both proteins and red blood cells is lost, and as a result of glomerular damage, glomerular filtration rate, which is the rate of fluid being filtered by the kidneys, will begin to fall, and these patients will develop renal failure. So, the red cells present in urine are dysmorphic red cells, or red blood cell casts. There is proteinuria in nephritic syndrome, but it is less than in nephrotic syndrome. So there is an excretion of less than 3.5 grams of protein per day. And this is due to a lower glomerular filtration rate. So now let's talk about the pathology of the syndrome. With damage to the filtration barrier, protein is spilled into the urine, and you have dysmorphic red blood cells and red blood cell casts in urine as well. Since there is a decrease in glomerular filtration rate, patients will present oliguria, or low urine production, and a raised blood urea nitrogen to creatinine ratio. Also, because the GFR falls, the hydrostatic pressure inside the vasculature increases, so patients with nephritic syndrome will often have hypertension. The increased hydrostatic pressure, together with proteinuria, will also lead to edema. With that being said, the classic presentation of a patient with nephritic syndrome is dark urine due to the presence of red blood cells, swelling, fatigue due to uremia, which is the high presence of urea in the blood, resulting from a low glomerular filtration rate. And they will have proteinuria, but the key here is that it is less than 3.5 grams of protein per day. Thank you for watching this video. If you enjoyed, please leave a like and subscribe.